So the next lecture, we've now talked about environmental health generally and air pollution, and I'd like to focus on water pollution and water and sanitation related diseases. So some sources of pollution or contamination include improper waste disposal, improper construction, poor site selection, wells that are not properly abandoned, improper waste storage, and lack of information on hazardous sites or activities. And again, these are just a very partial listing. Because water pollution can come from a variety of sources. So, non point source or NPS pollution, unlike pollution from industrial and sewage treatment plants, come from many diffuse sources. NPS pollution is caused by rainfall or snowmelt moving over and through the ground. As the runoff moves, it picks up and carries away natural and human made pollutants, finally depositing them into lakes, rivers, wetlands, coastal waters, and even our underground sources of drinking water. And as I stated in a previous lecture, there are a number of environmental effects on health that are related to drinking water and water that we use for sanitation and hand washing. Again, almost 2 billion people use drinking water from sources that are contaminated with fecal matter, and that contaminated water can transmit diseases such as diarrhea, cholera, dysentery, and typhoid. Contaminated drinking water is estimated to cause about 500,000 deaths due to diarrhea each year. And this is only expected to increase, with about half of the world's population living in what are considered water stressed areas. And most of those areas are made up of by these low and middle income or developing countries, which lack not only safe drinking water, but also do not have improved sanitation and lack water and or soap for hand washing. And so, if we can have an impact on access to safe water, both drinking water and water for cooking and using to wash our hands and sanitation, we could potentially save, 800,000 or more lives per year just from diarrhea alone. And because it's preventable of those 800,000 deaths, we're looking at about 361,000 deaths of children under the age of 5, so very young children. The World Health Organization had Millennium Development Goals, and one of their goals was access to drinking water, and it was met globally in 2010. The target of that particular Millennium Development Goal was to halve the population, so one half of the population, or half the proportion of the world's population without sustainable access to safe water. So looking at the population that currently did not have access to safe water and cut that number in half. The goal overall was met, but 48 of the least developed countries did not meet the target, though substantial progress had been made with 42% of the population in those countries for gaining access to improved drinking water sources since 1990. So progress has been made, but there's still work to be done. In particular, there are sharp geographic, sociocultural, economic inequalities that persist, not only between rural and urban areas, but also in towns and cities where people living in low income, informal, or illegal settlements usually have less access to improved sources of drinking water than other residents. And beyond the sort of human, environmental, and health impact, there are also, and the reasons for wanting to improve it, right? We should not want children under the age of 5 to die from diarrheal illness. There are also economic and social impacts. So when water comes from improved and more accessible sources, people spend less time and effort in physically collecting it, meaning they could be more productive in other ways. It can also result in greater personal safety by reducing the need to make long or risky journeys just to collect clean water. Better water sources also means less expenditure on health, as people are less likely to fall ill and incur medical costs, and therefore better able to remain economically productive. And as stated in a previous lecture, children are particularly at risk for environmental risks and hazards, particularly water-related diseases. And so access to improved sources of water can result in better health and therefore better school attendance, and with long-term positive health consequences for their lives. And this is just a partial listing of water and sanitation related diseases. Contaminated water and poor sanitation are linked to the transmission of diseases such as cholera, dysentery, diarrhea, hepatitis A, typhoid, and polio. Absent inadequate or inappropriately managed water and sanitation services expose individuals to preventable health risks. So these are things that don't have to happen. This is particularly the case in healthcare facilities where both patients and staff are placed at additional risk of infection and disease when water, sanitation, and hygiene services are lacking. Globally, 15% of patients develop an infection during a hospital stay, with a proportion much greater in low-income countries. Inadequate management of urban, industrial, and agricultural wastewater means the drinking water of hundreds of millions of people is dangerously contaminated or chemically polluted. As we mentioned of the diarrhea as a cause of death, this is largely preventable. And if we were to address those risk factors, we could prevent over 300,000 deaths in children and 800,000 deaths in adults. Where water, again, is not readily available, it impacts what you drink as well as your personal hygiene. And diarrhea is the most widely known disease linked to contaminated food and water, but there are other hazards. Almost 240 million people are affected by something called schistosomiasis, down here, which is an acute and chronic disease caused by parasitic worms that are contracted through the exposure to infested water. In many parts of the world, insects that live or breed in water carry and transmit diseases such as dengue fever. Some of these insects, known as vectors, breed in clean rather than dirty water, and household drinking water containers can serve as breeding grounds. And the simple intervention of covering water storage containers can reduce vector breeding and may also have a co-benefit of reducing fecal contamination of water at the household level. Another risk factor is lead poisoning, and lead poisoning can occur through exposure due to air, water, and food. So industrial lead, leaded gasoline, lead piping, ceramics, lead solder in the seams of cans, and lead paint, for example. And there are significant toxic effects associated with long-term exposure. And blood levels as low as 10 micrograms per deciliter, seems pretty small, has been associated with learning disabilities and behavioral problems in children. And how can we prevent lead poisoning? Well, environmental standards for lead gasoline, paint, and plumbing supplies have been enacted. But a bigger problem, and what we're seeing now in Flint, is the removal of, or the use of lead pipes. And so if you live in an area where you know you have lead pipes, it's always a good idea to flush those pipes with cold water first thing in the morning to try to get as much of the lead that's been sitting there and sitting on that water out. But we also need enforcement of occupational health standards, water treatment, and screening for children for secondary prevention. And I'd like for each of you to view two webinar series that were put out by the American Public Health Association that look particularly at Flint, Michigan and lead and the Water Public Health Connection, as well as really understanding what the public health's legal authority is for safe drinking water. Each of these links will be up on Canvas, and you'll be expected to view each of those and respond to them in the discussion posts.